Thank you all for tuning in today. Today we mark the beginning of our NEET PG preparation series that features top authors from Elsevier. The aim of this series is to simply to provide valuable insight into exam preparation. We will delve into important topics and explore effective exam techniques here. To kick off this series, we have the honor of having Dr. Usha Vishwanathan with us. She's a professor of obstetrics and gynecology at Sri Ramchandra Hospital, Chennai. She's also the author of the textbook of obstetrics published by Elsevier. She was appointed as the subject expert to develop the competency-based undergraduate curriculum that was rolled out in 2019, which is also very much in use in our exams, in our books every day, that this is the curriculum that we are using currently in the MBBS. She also serves as the coordinator for AdCom sessions for MBBS, and we are thrilled to have her with us. And let's give her a warm welcome and drop some hearts in the comments, everybody. Thank you, ma'am. Over to you.
Thank you very much. Okay, the session today is going to be how to crack the NEET PG exam. Am I audible? Yeah. So how to crack the NEET PG exam successfully as much as possible in the first attempt. I think the date is going to be the 23rd of June 2024. Because of the elections, it's moved on to that date. And this NEET is going to have 200 MCQs. So which means 4 marks for each MCQ. That will give you 800 marks. And there is negative marking for the wrong answer, which will be -1. And if you don't answer, obviously you get no marks, but there's no negative marking. So let's not get into which is the best scoring and things like that. So as I was browsing, I found 705 was the highest mark in the year 2022. Now, what do we do when we are writing this NEET exam? I think it's important that we answer those MCQs that we know very well first. So as we start answering, we go ahead for those questions first. Now, before I move into how we answer the MCQs, let me say, as far as obs and gynae are concerned, which are the topics that you should really go ahead and focus, the topics of importance. I wouldn't say other topics are of less significance, but these will probably have much more weightage. High-risk pregnancy, hypertension, diabetes, anemia in particular. All about labor, physiology of labor, conduct of labor, mechanism of labor, everything concerning labor, because obviously that is what obstetrics is all about. Postpartum hemorrhage, nationally relevant topic. Most mothers die of this condition, so this is a must-know topic as far as undergraduate curriculum is concerned. Antepartum hemorrhage, another topic which can cause morbidity and mortality in the mothers. Cancer cervix, the highest female genital tract cancer in India. At any given point of time, there are about 1.5 lakh women in this country having this particular cancer. Then all the screening methods via Willi, Pap smear, colposcopy, etc. Medical termination of pregnancy, you must learn the recent amendment because the initial one was enacted in 1971, and then we have had a recent amendment where there are changes made by the Government of India. Maternal mortality rate, perinatal mortality rate, and all the values, the statistics, and the causes. First trimester complications, abortion, ectopic pregnancy, hydatidiform mole. Antenatal fetal surveillance, all about biophysical profile, non-stress test, fetal kick count, everything pertaining fetal surveillance and fetal well-being. Multiple pregnancy, very important. With assisted reproductive techniques, we are having a surge in the number of multiple pregnancies. So it's a high-risk pregnancy which we are encountering in large numbers. All obstetric emergencies like shoulder dystocia, rupture uterus, eclampsia, ruptured ectopic, all these have to be focused at. Preterm labor, one condition that is predominant across the world and we are simply unable to control because the cause is not known definitely. Fetal growth restriction, operative vaginal deliveries of forceps and vacuum. In all malpresentations, focus on breech more than the others. Complete perineal tear and episiotomy, very important. Then all about lactation and puerperal fever and causes of fever. And we have to keep in mind that the most common cause that should come to your mind whenever a woman develops fever soon after delivery has to be a urinary tract infection. And this is one of the MCQs very commonly asked. Contraception. All methods of contraception, hormonal, non-hormonal, male, female, permanent, temporary, and emergency contraception. Then heavy menstrual bleeding, abnormal menstrual bleeding. Commonest complaint that most women come to us with. Menopause, puberty, fibroid and adenomyosis. The most common cause of abnormal uterine bleeding in women of the reproductive age group. Cancer of the endometrium, cancer of the ovary. Sexually transmitted diseases like trichomoniasis and moniliasis, candidiasis. Of course, even bacterial vaginosis. Then we have anxious to conceive, that is infertility. Very important, both male partner and the female partner. All that is important. Uterovaginal prolapse, polycystic ovarian disease, it's become a very common man's term now. Hormone replacement therapy. Tubal sterilization, nationally relevant topic. Imaging in obs and gynae, like role of ultrasound, MRI, and CT. And finally, laparoscopy and hysteroscopy. So these are some of the topics that I feel that you should focus a lot more on, because the weightage is much more in these topics. And you know why the weightage is more in these topics? Because we generally divide topics as must know, may know, and it's good to know. So must know is something that you should definitely know. May know is one shade. If you're finished with all the must know, then obviously you'll move on to that. And good to know is commonly when you write your medal exam and prize exam and you're one grade higher, you also want to know what is good to know. So these topics that I have told you is all must know topics. Remember that negative marking is -1 for questions which are answered wrong. So if you are pretty much sure that this answer may be right, may not be right, you can attempt a few of them. But remember, if you get too many negative markings, then 4 negative marking is going to pull down 1 correct answer of yours. So think it over, and then an unanswered question may probably do you better rather than 4 wrong answers. Then what happens? There are 3 sections. I'm sure you know we have the preclinical, paraclinical, and we have the clinical. And I'm sure you know the weightage of every subject that's there. And you have 30 MCQs as far as obs and gynae are concerned in this 3.5 hours period that you are actually going to be writing. So how do we go ahead and get better and better cracking all these MCQs? MCQs are very simple. In fact, they have 4 options and you have to choose the one best option. Now remember, if you have MCQs where you have a clause that says except, then you'll have to think a little bit more before answering. And there is a rule that the number of questions which have except should not be more than 10% of the number of MCQs. So whenever you have this except, give a little more thought to it. The best is to keep on answering MCQs as much as possible. Keep practicing. It will improve your analytical ability. So there are different kinds of MCQs. For example, Uterine artery is a branch of one, anterior division of internal iliac, posterior division of internal iliac, obturator, and something else. So this is recall memory MCQ. This means you're just learning that uterine artery is a branch of the anterior division of the internal iliac artery. So it is out of memory that you are answering this MCQ. Okay. Now, if I give an MCQ that says the first clinical examination you would do in a woman with bleeding after delivery, vaginal bleeding after delivery is one, palpate the contractility of the uterus, check if the bleeding has clots, and some other two options. So here it is testing your clinical acumen of whether you're going to say that you will palpate the abdomen for the contractility of the uterus. So this is an MCQ which is testing your clinical ability. The next type of MCQ is where you can say that a patient has come in labor and she has a ketotic breath, her urine ketones are positive, she's also a diabetic. The investigation that you would probably do in this patient are 1, 2, 3, 4. So let's say it says urine ketones, arterial blood gas, and etc. etc. So this is an analytical MCQ. It's getting you to think if there is a situation clinically handling a patient, what is your analytical ability and what is the one investigation you are going to choose which is going to hit the diagnosis and helping you in managing this patient. Okay, so this is the higher order MCQ. So you'll have to think a little more because both the answers may appear right, but one of them you are able to choose only one. So if you are choosing that one correct answer, it has to be the most definitive investigation that's going to give you either a diagnosis or help in the management. So these are the various kinds of MCQs that you can actually get. So read standard textbooks so that you know how exactly you can be answering these questions. And it's very important to manage the time schedule because if you don't know a particular MCQ and you dwell on it for a long time, the clock is ticking by. So, and then you'll get nervous, anxious, and then you will just tick something in the remaining MCQ. So let's not do that. Good practice is to complete all those that you're very familiar, very sure about, and then you can revisit. And when you do this mock questioning of these MCQs, and if you have made some errors, check on what aspect have you made that error. Now, I've already told you one is on recall, the other is on clinical aspect, the third is analytical. Mainly, these are the three categories in which you will be questioned in an MCQ. So you know that if you are not learned a particular topic, the recall memory gets difficult. So if you read very standard textbooks, you know how to manage clinically. Focus on the clinical aspect because I think a lot of MCQs nowadays in NEET is on clinical aspects. Even in surgery, there were questions like if there is a tear in the ortho, I think, in the ligament, what kind of suture material would you use? If there is bleeding from the wrist, what is the first thing that you would do? So this is basically testing you on the ground as to how effective a physician you would be when you complete your post-graduation or whatever specialty you want to take. And then you need to plan as to which are the topics which are very difficult for you. So you have to prioritize your difficulty index. So choose the top 10 topics which you feel that it's very tough for you. And there may be topics which you're very familiar and which you're very good at. Very important is to have concepts. To have concepts and principles. Like for example, the principle of a good myomectomy is to achieve complete hemostasis, to have minimal tissue handling. So these are some of the principles. So these questions, how they will ask is the principles of the myomectomy are the following except. which means 3 are right and 1 is not the principle of myomectomy. So you should be able to pick those based on the knowledge that you have achieved reading all about myomectomy. So there are certain topics which may be a little deviation, like for example, amenorrhea. Amenorrhea is not very commonly asked, especially for undergraduates, but you may find a question on primary or secondary amenorrhea. So what is the first important thing you should remember? Any woman with secondary amenorrhea, think of pregnancy unless otherwise excluded. And if it is primary amenorrhea, you're probably going to have, very importantly, 1 is the Mullerian anomaly. 2, it's going to be the Turner syndrome. 3, it's going to be the androgen insensitivity syndrome. So remember, these 3 are very important as far as primary amenorrhea is concerned. So this is knowing concepts in a very sound manner. So you must learn your concepts very well. Another example of concept, I can say. Let's say a pregnant woman at 24 weeks has had her glucose tolerance test. Her fasting is 200 and her postprandial blood sugar is 300. What is the next investigation you would choose doing in this patient? Obviously, you think that it is not gestational diabetes, it is an over diabetes. The next investigation you would choose is probably do a glycosylated hemoglobin, which will tell you the glycemic control during the previous 60 to 90 days. Okay. So this is how you have to work on it logically. You will also get serum fructosamine. You will get few other investigations. They may also appear right, but that is not the right answer, because the cost-effective single investigation that is logically you should be doing is only a glycosylated hemoglobin. Okay, so this is some of the ways in which you have to go ahead and really work on these MCQs and keep revising. And if there are MCQs that you are doing repetitively, no problem, because repetitive performance only reinforces your memory and then puts them even sounder. Another common thing that they can ask is staging of cancer, something that most students really dislike. I would suggest write down the cancer, cervix, endometrium, CA, ovary on a sticky pad and just stick it in front of your mirror. Look at it every day. Okay. By default, you will remember what is stage 3A of CA cervix when you're asked. You will never forget. This is something that I did when I was doing my PG. Because you just have to stare at it every day and something or the other is going to sit in your memory. Okay. So there are certain things that you can focus. And I think there are some students who would like to write down certain things. I am one of those characters who will write down. And when you jot down, of course, it's not necessary. It is the style of learning. When you jot down or write down, you are actually reinforcing your memory, because the visual impact is going to put into your brain in a stronger manner. But I wouldn't suggest this as the only method that everybody has to do, because many may not want to write. But this is one of the ways you can go ahead. And I think it's important, you still have time, make a calendar, put a time frame, divide the subjects according to the time that is available. Take interruptions, don't have to read all the time. You can listen to music for about 10 minutes, have a power nap maybe for 10 minutes, and then get back to your books. And have healthy lifestyle, sleep on time, wake up on time, don't keep late nights, and don't wake up very late, because that's not going to get you healthy. And eat what is healthy. Swiggy can take a break for some time till your exams are over, and then you can get back to your routine, because once you join PG, I think you'll have to forget Swiggy. You're going to be really, really busy with your routine. Okay, so it's important, and very importantly, avoid getting stressed. There'll be lakhs of people writing the exam. Everybody need not enter the PG at the first attempt. It may not happen. I joined PG on my third attempt. The first time I got ophthalm, I didn't join. The second time I got dermatology, I didn't join because I wanted to join only OBG. And it's only the third time that I got OBG. My father was saying, join Oftal because you'll give sight to people and it's such a very nice specialty. But then I waited. So that is being persevering. So be perseverant, but be a little flexible because times are changing now. It's not the same. Every year you wait, you have a flood of people joining NEET exams. Okay. So learn to relax, don't get stressed. And remember, NEET exam is not the end of the world. There are so many other good things to be doing. This is also a part of our life, but this is not the only thing. So I wish good luck to each and every one of you. And I hope that you are able to join the course that you dream, because I always say, choose a specialty that you really wish to do for a lifetime, because it's like getting married. Okay. Once you're married, that person is your partner, life partner. Likewise, you choose a specialty that is your life partner at workplace. You can't take a U-turn or go back. Do something that you love to do and something that you will be passionate about doing it for a lifetime. And there's nothing to stop you. You will go heights, and teachers like us who have taught you will feel proud that at one time we were there to teach you and get you to where you are. Thank you, and I'm open for questions.
Thank you so much, ma'am. I think one of the questions that came to us was also about how to manage stress, and you have really captured that well. Don't take stress, don't sleep well, eat well, get rest, and focus on getting the concepts right rather than getting it at the first time. So the other questions that we have got, one of them is on pathogenesis of molar pregnancy. If you can very briefly cover it, if possible, during the session. Molar pregnancy is, I'm sorry.
Okay. Molar pregnancy is primarily of two types. It is complete mole and partial mole. The more common one is the complete mole. Just remember, pathogenesis is in partial mole, you can find a fetus. In complete mole, you will find no fetus. And 80% are complete mole. And what is the pathogenesis? Just remember one line: excessive trophoblastic proliferation. So you get plenty of beta HCG and you will get all vesicles and you will find no fetus. So if you find exponentially high levels of beta HCG, it is because the trophoblasts have proliferated in plenty, and that is the pathogenesis that you have to remember. Excessive proliferation of trophoblasts.
Ma'am, the other question in the chat was, while stitching the cervical circlage, what if the stitch punctures the bag of membrane?
That means you're woken up from the wrong side of the bed, because you can't do anything. That means, see, commonly cervical encerclage is McDonald's encerclage. The most common procedure is McDonald's. The other methods are Shirodkar and worms. Shirodkar is where we dissect the bladder and we put a stitch at the level of the internal os. So there also you're unlikely, not very common to go and rupture the membranes. But in worm cerclage, WURM apostrophe S, worm cerclage, you can injure or rupture the membranes. If you have ruptured and it is a low rupture, you just have to wait and see if the leak is continuing. Because sometimes there can be sealing of the rupture, because a very small part of it has been injured and it will seal on its own, and pregnancy can continue on its own. Well, but if not so, then probably she will go ahead and abort. That is, she'll leak continuously and she will become anhydramnios, in which case you may have to abort.
I hope you got that answer. The other question is, in umbilical cord, if umbilical cord is torn, there was heavy vaginal bleeding mentioned. So what will be the best option?
I think they are talking of snapping of the umbilical cord while delivering. So this can happen only during a delivery of the cord when there is excessive pressure or traction applied on the cord, number one. Or it can happen in growth restricted babies where the cord is very thin. And if there is undue force applied in delivering the umbilical cord, you can do it. See, what you need to do is get an artery forceps, curved artery forceps, and then whatever part of the cord you are able to view outside the vaginal outlet, you just clamp it. And then you track upwards to see which part of the cord is actually bleeding, and then go a little above that and clamp the second one.
Right. Ma'am, the other question I think you briefly touched in your session about the any recent advancements in obstetric care, or like you said, there were some amendments. What are these important from exam perspective, and how should one prepare for that?
See, as far as the recent advances are concerned for PG NEET, I was talking of the amendment of the MTP Act because that is something recent. Previously, it was done only up to 20 weeks, and now we are going ahead and doing up to 24 weeks. So this is an amendment which is recent. Otherwise, there is recent advances in almost every topic that we are talking of. ART, that is assisted reproductive technique, is one area where there can be several recent advances, especially with regard to the regimens that you give. But for NEET PG as undergraduates, they may not to touch upon too many of them.
Okay.
But ART is one more area where you have to. All the screening methods like screening for hypertension, screening for preterm labor, screening for fetal growth restriction, Doppler in obstetrics. These are some of the recent ones that you can focus on. And of course, as far as cancers are concerned, chemotherapy drugs. There are a lot of recent chemotherapy drugs and recent advances in chemotherapy which are being used.
Right. All right. Okay, ma'am, that was all for the questions that we got. Thank you so much, everyone. And that's all for today. We have our next session planned on pediatrics, which is going to be similar to what ma'am covered, focusing on the NEET PG preparation. You can keep a lookout on the Instagram page. You'll get more information on those pages. And a link will be shared for any questions that you would like to share with us. Also, we are circulating a extended discount coupon code in the chat. Please feel free to use it online to avail any purchases you may want to do. That's all for today. Thank you so much, ma'am, for joining us and for your time. And thank you, everybody, for joining as well.
God bless.
I hope you had a good session.
Good luck.
All the best for your sessions.
Thank you.
Thank you, ma'am.